Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes, and today we are going to record the speaking session. Before you listen to this wonderful speaking session, please subscribe our channel or call us on +91 76 967 34256 for the best OET coaching. But do subscribe our channel for the best OET videos. And also there are various information like the last information I have uploaded about the NHS, that you would be able to take up your spouse, your partner with you. So there is nothing to worry when it comes to NHS as per the update what I have seen. But again, we are not the best of the migration agents. We are the best when it comes to OET. So you can ask from your respective agents or we can help you later on. But for now, what I feel is that there is no change on the dependent visa. So nothing to worry. Again, guys, these negative news come to you to change your focus. Please don't lose your focus. OET was, OET is, OET will be the easiest and the best thing for the nurses. And I am just going to prove this with this video. So I'm just gonna switch it on. We'll take those extra pages for you to discuss about the speaking. So when it comes to OET speaking, of late, you would have heard from your friends that sometimes people score around 314 speaking. What are the various reasons when you need 350? Why do good people lack these 10 points? See, these 10 points are very, very important. And I would like to tell you guys, these 10 points are majorly of summarizing the task in the end. Sorry, I'm starting the task from the end, but this is the most important point. Sometimes examiner would be reluctant. Sometimes examiner would be in hurry. But you have to maintain yourself that in the end, you need to say, I would like to highlight the key points. This is very important. I would like to highlight the key points of the conversation. Suppose if patient is having migraine, so you would say, I would like to highlight the key points of the conversation, that as you are having migraine or as you are suspected with migraine, so doctor has done your checkup. So according to doctor, he has prescribed you some medication. It is very important to take those medications. Means you don't have to complete the whole thing. You don't have to speak the whole task, but you highlight the main key point of the conversation. Suppose if the patient is having end stage renal failure and he is waiting for the kidneys, means transplantation of kidney. So if we are unable to find the donor, so talk about the main point, that don't worry, you should continue with the dialysis and we will try to find the donor, and our team is trying their best to find the donor as soon as possible. So please maintain your positivity. Rest. If you need anything else, there is a buzzer beside your bed. So when the patient is in the hospital, you say there is a buzzer beside your bed and you can press it and we will be here to help you. So this is the line that you end up when the patient is lying on the bed. When patient has come to you and is getting the discharge, so always hand over the leaflet. Now I am giving you this leaflet and it contains all the information what we have discussed. It contains all the information regarding migraine and what we have discussed. Also, there is a number that is in the leaflet. You can call on that number if you need in case of emergency. Number in case of emergency, that's it. So that is how you end up the task. When you are sending the patient or discharging the patient back, it is important to tell the patient that this is the contact number of the emergency that is written in the leaflet. So please, and also now I will talk about various points. So this is about ending of the conversation. Ending of the conversation is very important. Examiner sometimes can be reluctant, sometimes can be hurry, but please try your level best to summarize the task. You can also say, now I would like to summarize our conversation. Yeah, I would like to repeat the key points of our conversation, and don't repeat the whole task. Just precisely talk about things. Suppose if the time is 4 minutes and 30 seconds, examiner will help you and will tell you to summarize the task. So if there is one point that is left, just try to cover that in the summarization part. Means don't worry about one point. Summarization is more important than covering that single point. Summarization is the key to pass OET speaking. So when people get 340, it is majorly 90% it is due to the summarization of this task. Second most important thing is listening. I'm not talking about OET listening, guys. I am talking about listening to the patient. That is the most important thing. If you are not listening to the patient, then you will not answer. Means it is not important to go with the points in sequence. You cannot cut the patient's question just because you want to cover the points in the sequence. You need to break the sequence. First of all, answer what patient has asked. Suppose if the patient has asked about the treatment and you have not examined him, and examination is one of the parts, then you tell this thing to patient, I am really sorry, I will explain you about the treatment later on. First of all, I need to examine you, or first of all, I need to ask you some questions. Means you cannot do that. Patient says you, can you please tell me the treatment? You say no, first of all, I need to cover the I need to cover the questions, I need to do this thing. You can't do that. You have to be really polite, because they want your politeness, they want your professionalism. So that means you will say, I'm really sorry, I can't explain you about the treatment at the moment. First of all, I need to ask you some questions. After getting your replies and after examination, I would be able to tell you better about the treatment. So you need to cover, I would be able to tell you better about the treatment later on. So now take your pencil, because I can't write everything. Take your pencil, take a notebook, write it. Pause this video, listen to this small conversation again, write it with your hands. Till the time you will not write with your hands, nothing good will happen. Don't expect that you are miracle person, having magic in your hands. Only hard work can help us to pass, that is with writing. You need to write what you want to speak, so that you can have confidence on that thing. Write anything, then watch it, speak it, watch it, speak it. Then after 10 times you would be able to speak it naturally. So sometimes you try to remember the lines, you will never be able to remember. Please, there are too many lines, so write it, speak it after watching, and then try to remember. So that is how you will be able to learn new lines. I hope you all are understanding. And now taking to the point again. Again, summarizing again. Summarization, highlighting the key points are very important, like the way I have told you just now. If I do not highlight these key points that, summarization is very important, then you might miss it. In the same way, when patient learns from you, then he can also forget something. So you need to understand those things that you need to repeat. Okay. And it is very important to keep asking in between. Are you getting my point? Are you understanding me? Am I clear so far? Is there anything I should repeat? Lines like these should be spoken after some time, means one line you can speak. Are you getting my point? Then you say, okay, let's go ahead. Okay. Are you understanding me? Okay. Then I am taking you on to the next important point, which is this. Am I clear so far? Should I repeat anything for you? Okay, that's fine. Now let's go to another point. So that means you have to cover these things in a very nice way. So this is what fetches you marks. Listening to the patient is most important. Again, you cannot break the conversation. That is what it is all about. The maximum marks are there, that if you listen to the patient well, you respond to the patient. That is what conversation means. That is what role play means. That is what OET speaking means, that you have to speak nicely with the patient. So these are the major points that you need to cover. Rest, obviously, we all know how the conversation in medical line goes, because we all are nursing and nurses and doctors. First of all, if questions round is there, you ask the questions like what, like, good morning, my name is Bhupesh, I am a nurse over here, how may I help you? Okay, so first of all, I need to ask you some questions. When did you face this problem for the first time? This is a common line that you can use in every speaking. What is, when did you face this problem for the first time? This is a very, very easy and a genuine line and would fit in every role play. And this will give you a lot of marks because this contains past indefinite tense. When did you face? This tells a lot about your English to the examiner. When did you face this problem for the first time? Then you say, okay. Don't say, never say, mm-hmm, mm-hmm. Never do that. You say, all right, I have noted it. You keep on changing. All right, I have noted it. Okay, that's fine. So that is how you go on with the role play. That is what professionalism means. Means there can be many reasons for this small break of 10 points, but that can be because of these things. When you do mm-hmm, mm-hmm, you should not do like this. You should say, all right, I have noted it. Okay, now let me ask you one more question. So that is how you go ahead. Let me ask you one more important question. So this is like how you manage things, and most of the questions will go, do you smoke, do you drink, do you exercise? Okay, then you say, all right, have you been hospitalized before? Again, write it. And have you ever faced this problem before? These are the major questions that you normally ask in OET. Have you ever faced this problem? Have you ever faced, sorry, this problem before? That is how you go about these things, guys. So once you will do that, fine, obviously you will have more chances. So questions after the question round, always if there is examination, so say, okay, now may I examine you? May I examine you? So this is another thing. You don't do examination straight away without asking patient. Okay, now may I examine you? Okay, yes, thank you for giving me consent. That is how simple it is. Thank you for giving me consent. Okay, then you say, okay, small pause. Thank you for giving me consent. Okay. After examination, I have found. This is a pet line that will go with every after every examination. I have found that you are having this problem. So that is how OET speaking goes. Now I will again do it for you. Good morning. My name is Bhupesh. I am a nurse over here. How may I help you? Oh, nurse, I am having severe headache. Okay. So before we go forward, I would like to ask you a few questions. May I? Yes, please. Okay. First of all, I need to ask you, when did you face this problem for the first time? Well, nurse, I don't know. It just started a week back. I had this headache and now it is pretty much, occurring again and again. Okay, so I would like to ask you second important question, like, is it persistent or is it intermittent? Like, is it continuous headache? Oh, well, yes, nurse, it's almost continuous. I'm having that continuous headache all the time. And sometimes it is really severe, it is moderate. Okay, suppose if I give you a pain scale where 1 is the minimum, 10 is the maximum, how much is the pain? Nurse, it is 8 out of 10. Okay, so you mean that you are having severe pain. Am I right? Now this is, am I right? Okay, okay. So I have noted it all. And now I would like to examine you. May I? Yes, please, nurse. Okay. After examination, I have found that you are having this and this problem. Maybe it might be migraine. Oh my God, nurse, you are saying I am having migraine. No, I am not saying you are having migraine. I am saying that you are having some symptoms which is correlating with migraine. So doctor is the right person. Doctor is the authorized person who can make the diagnosis. So you need to wait for the doctor. But nurse, you are a nurse, you are an experienced person. Can't you make the diagnosis? Can't you tell me, am I having migraine? See, I would really like to tell you that you should not be negative, because doctor will come soon. He will examine you again and he will make the right diagnosis. So please calm down. It is very important to wait for the doctor, as doctor is the authorized person to make the right diagnosis. Are you getting my point? Oh, well, yes, nurse, but I don't know. I'm really scared. Please don't be scared. We all are here to help you. There is nothing to be scared. It's just you are having headache and doctor will give you some medications. You will start feeling better with it. So doctor will provide you the right treatment after making the right diagnosis. Are you getting my point? Are you understanding me? All right, that's great, Mr. John. So now you need to wait, and I would like to highlight the key points of our conversation, that you are having headache and your symptoms are somewhat correlating with migraine. But again, doctor would be the right person who has already been informed. he is coming soon, and he will make the diagnosis and will provide you the appropriate treatment. There is a buzzer beside your chair. You can press this buzzer if you need anything. Within 10 to 15 minutes, doctor is coming to you. Is that fine? Okay. Then take care of yourself. Okay. Never say see you soon. It's not a good thing. I also have that tendency to say see you soon, but don't say to the patient see you soon. This can also be one of the problems you might be doing. Okay, patient, see you soon. Nobody wants to see a nurse or a doctor in a hospital again. So you, in medical line, you never say see you soon. So I'm not saying this will completely get you out of the track if by chance you have spoken. Only one line cannot be the reason of failure. There can be many lines. If you have spoken well, if you have done your best, you will pass easily. Again, the key point I would like to say, have a notebook, have a pencil, listen to this speaking 2 3 times. One time will not help. Then again, guys, you will keep on doing other speaking. First of all, this is a speaking session I have recorded especially for you, so that you can become master of speaking. So please listen to this session 5 to 10 times. Note important points, try to speak in front of mirror and feel the difference. You will all of a sudden start feeling better. This is Dr. Bhupesh. Please subscribe our channel if you have not, and contact us for the best OET coaching. Number is +917696734256. Thank you very much. So I hope you all have understood the key points. Now I will take your doubts regarding the speaking, but we will not give too much time to this session, because now I will start with the next session, that was writing punctuation. If it is required, I will try to cover it up within like 2 minutes. It's just the writing punctuation that you have asked me the second question, but please listen to this recording multiple times. Thank you very much.